Hello and welcome back to the Anti-Aging Hacks podcast. Today, my guest is Dr. Sharon Stills, who's a licensed naturopathic medical doctor with over 2 decades of dedicated service in transforming women's health and has been a guiding light for perimenopausal and menopausal women, empowering them to reinvent, explore, and rediscover their vitality and zest for life. Her pioneering Red Hot Sexy Menopause program encapsulates her philosophy to reinvent your health, explore your spirit, and discover your sexy. This unique approach has revolutionized the way women experience their transformative years, making her a sought-after expert in the field. Dr. Stills continues to share her knowledge to the annual Mastering Your Menopause Transition Summit, which we will be talking about in this podcast. She's also opening a new 7,000 square foot clinic in Scottsdale, Arizona to provide unparalleled naturopathic care. With that said, Dr. Stills, welcome to the Anti-Aging Hacks Show. Would you like to get thicker, fuller, and stronger hair? Then make sure to check out fullyvital.com. The team's come up with fantastic and natural products that help rejuvenate your hair, but also delay and reverse gray hairs. So if you're interested in better hair, go to fullyvital.com and use the code ANTIAGINGHACKS for 15% off your order. Are you enjoying the shows on this channel? Then please make sure to hit the subscribe button down below so you can get notified when we release new episodes. Our goal with this show is to help you and give you practical tips that you can use to slow down and reverse your aging so you can live and feel younger and live your best life. With that said, let's get on with the show.
Thank you so much. It's really my joy to be here.
Totally. So in the past, this subject that we're going to talk about, menopause, has been quite taboo to speak about in public. It's been a matter of shame and embarrassment, but I think the conversation is changing quite a bit. In no less in part thanks to experts like you, which are hosting a summit every year now with tens of thousands of attendees that are listening, and you're also bringing in dozens of experts to help unlock or shed light on the different facets of menopause that may not be so obvious to outsiders, but also to women that are experiencing it. So tell me about your views on menopause and how is the conversation changing as well?
Yeah, the conversation. Well, I'm definitely a part of changing that conversation because it's true, like you were saying, taboo. And I know so many women who think that menopause is the beginning of the end, that menopause is when it all goes downhill, and that aging has to be this horrible experience. And when you hit 40, 50, that's it. Your good years are behind you. And I'm here to say that's absolutely not true. Maybe it was in the past generations, because they didn't have the knowledge or the natural healing techniques weren't out there as much to help women through this time. But I know I'm living proof, and I have tens of thousands of women and patients who are living proof that you can feel better than ever once you are postmenopausal, that it is not the beginning of the end, that you do not have to get fat and go out to cat pasture like a cow, that you can, you might not be able to birth babies anymore, but you can birth like me. You can birth a 7,000 square foot clinic. I'm going to be 57 when my clinic opens, and retirement is the furthest thing from my mind because I don't take those societal views that it's downhill. And so we really have this beautiful opportunity to change what it looks like to age in our society and to change that in the younger generation so they see us. My granddaughters see me and they don't think 50s are old. They think 50s are, run around with me, Bubby, get down on your knees, you're going to be my horsey, I'm going to ride you today. And so they, and I know when I was growing up, I thought 40 was old, and it was mirrored to me that it was old. And, I love my parents and my grandparents, but they were kind of old at that age, right? They
Yeah.
were gaining weight. They were slowing down. They were just sitting on the couch watching TV. And that's not the case nowadays. And so we first have to change the mindset. We have to change what we think about growing older, aging, menopause, and start to get excited about it. I always say aging is this beautiful privilege, and not everyone gets to experience it. So we really have to have gratitude and reverence for every day we get to be alive, and every day we get to grow a day older. And so that is like first and foremost just the way we think about menopause. Then when we think about the way we are treating menopause in my world, Women are, reversing autoimmune disease, they're losing weight, their skin is getting brighter, their hair is getting fuller, thanks to some of your products, of course, and they are having more energy. They are sleeping like babies again. They are rediscovering their sex drive and their passions, and they're having emotional stability. And so, why is this happening? Well, I look at healthcare as as a pizza pie, right? And so a gluten-free, dairy-free pizza pie, not one full of gluten and dairy, but slices, right? So there's slices of pie, there's slices of life. And healing is embracing our whole pie. So we talk about, and I'm known for bioidentical hormone replacement, and I love my hormones. People say, how long are you going to do them? And I'm like, I'm going to be buried with them. You never know. I want to just cover all my bases. So I love my hormones. They are life changing. And I always say it's a myth that there's a magic bullet for healing. But if I had to pick something that would come closest to being that magic bullet, it would certainly be bioidentical hormone replacement, done properly, monitored properly, and we can talk about that. But so we have these hormones, but these hormones have to go into a body that is healthy, that is happy, that is balanced, that has, I always say, we have to put happy hormones into a happy, healthy, balanced terrain. And so while we're doing, a lot of people out there, they're looking for the quick fix, or they're going to these pop-up hormone offices and they're just getting hormones. And no one's talking to them about their diet, their movement, their gut health, their
Mhm.
lymphatic health, their liver health, their bile flow, and so on and so on. And so in my world, I'm looking at all of these pieces because all of these pieces play a role in how we feel, how we age, how we prevent disease. So when we think about menopause, like what's the first thing we think about? We think about hot flashes. And menopause, yes, you can have hot flashes, but you can also have over 100 other symptoms, from burning mouth to joint pain to urinary infections to immune dysfunction to hair loss to skin. I mean, it just digestive issues, things that we don't think about. And so, yes, of course, I love helping women feel better, right? So, yes, I don't want you to have hot flashes. I don't want you to have mood swings. But I also want to help you prevent, and hormones play a key role in so many of the systems of our body. They're supporting our cardiovascular, they're helping to keep our arteries clear of plaque to reduce blood pressure. They're helping with our bones to reduce bone loss. They're helping with our brains to help with memory and prevent Alzheimer's disease. They're helping regulate our immune function. They're helping regulate our digestion and how fast we eliminate. They're playing a role in our gut health. They're playing a role in our genitourinary health. They're playing a role in our moods and our neurotransmitters. And so there's like these two pieces. There's the piece of, yes, I want to feel good and get rid of my symptoms. And then there's the piece of, what can I do to give myself the best chance to reduce chronic illness and age gracefully?
hmm Love that, Dr. Stills. Thank you for answering that question. You certainly looked the part. I had no idea you were 57, by the way.
I'm
Uh,
56 and a half.
56 and a half. Okay. Okay, coming up. You have a lot of hair. It's gorgeous hair, by the way. You're very,
It's
very
wet now.
lucky.
I just got out of the shower.
Yeah, because I've seen your hair and I go, wow, wow, what's she doing? So very well done. And also, I think you have this youthful zest about you, which I appreciate. It is obvious to anybody that's listening to the conversation, is that you embody what you're talking about. You're not just, just speaking or giving lip service to this. So which is very great to see. Also, the point you said, our parents' 40 looks way different than our 40. It's a whole different paradigm and a whole different world. And with longevity sciences coming online, who knows where the future is going to be. I have a couple of quick questions for you. So, the average age of menopause in the United States is about 51, which means there's a lot of women that are having early menopause, and then, of course, many that are having later menopause. So, I know that hysterectomy is one reason why women can have early menopause, but are there other reasons that are not so obvious that you see in your practice or in speaking with other practitioners? What causes women to go into early menopause, and is that a sign of ill health?
That's a Great question. So yes, the average age is 51, which means some women are going to go. I have some women in my practice, they're like 60 and they're like, when is it going to stop, Dr. Stills? I'm still getting a period every month. And then
Yeah.
there's other women like myself. I was done by 48, which is, on the earlier side, but it wasn't pathological. I just fell on the earlier side of the average. And so when we're talking about early menopause, we're talking about early 40s, where late 30s. So there are different reasons. Some of them can be from if you have a cancer diagnosis and you've undergone chemotherapy, that can throw someone into an early menopause. It can be because you have a lot of toxicity you're carrying, and so your body is just out of all sorts and can't differentiate between good estrogens and xenoestrogens, and there's major imbalances. Could be from stress. We could talk for weeks about stress and the different kinds of stress, and we're never going to get rid of stress, right? It's just learning how to dance with stress, how to handle our stress, how to respond rather than knee jerk react. And some stresses we have control over, and some stresses we don't. We can't
Mhm.
control that 5G towers, or, we can protest, but, we're getting a lot of Wi-Fi. We can eat organic and there's still glyphosate ends up in our bodies. So there are
Mhm.
certain things we have more or less control of. We can certainly control what's going on within our house and what we're choosing to put in our body and on our body and thoughts we're choosing to think and so forth. So we can go into an earlier menopause and need a hysterectomy because we have an imbalance of hormones. So one of the things I see so often in hindsight, I even saw this from my own mother, because my mother had a hysterectomy in her early 40s,
Mhm.
is heavy bleeding. And so a lot of women get into the state of heavy bleeding, and it's because they have too much estrogen and not enough progesterone. And there's different reasons why. Sometimes it's not that we have an excess of estrogen, we have a normal amount of estrogen, but comparatively speaking, we don't have enough progesterone. So that causes an estrogen dominance. Sometimes we do have too much estrogen. We have to remember that progesterone is the precursor to the glucocorticoids in the biochemical pathways. So what are glucocorticoids? Fancy name for stress hormones. So
Mhm.
if we are stressed out, we pull through our progesterone into stress hormones because the body says survive or recreate, procreate, chooses survival. Progesterone is progestation. It's what helps maintain and allow for a pregnancy to occur. So a lot of women, and I see it in my practice, they come in and they've already had a hysterectomy, and it's like, if you could have seen me during that time, we could have prevented the hysterectomy because we could have balanced your hormones. A lot of
Mhm.
times it's liver congestion. The bile's not flowing, the liver is overworked, and we have to like really spend some time loving on the liver to get the hormones balanced. And so that is a huge cause for hysterectomies. Another reason is because so many women, it's so fascinating to me because there's so much fear out there about bioidentical hormone replacement, but yet they give out birth control like it's candy on Halloween. And birth control is synthetic hormones. We know that, especially the progestins, we know they're associated with an increased risk of cancer. And yet those get handed out. And I won't even work with someone who's on birth control because I just know where it's heading. And if you're not willing to get off something that's super harmful, and I get it, like everyone's always like, all right, so what's your natural answer for, if I'm on it for birth control? And I don't really have, I wish I had an answer. I'm like, you got to learn your body. Like I tell women use ovulation kits. Like a lot of women are using them because they want to get pregnant, but you
Mhm.
can use it to not get pregnant, right? It's just the
Yeah.
opposite. So, condoms, things of that nature, but birth control pills, so they're a big cause for hormonal imbalances and going into early menopause. So there's lots of different reasons.
Mhm.
Toxicity is a huge one, slowing down ovarian function. So that's why, I host the Menopause Summit, but I invite women like come in your 30s because prevention and pre-gaming is really the name of the game when it comes to health and certainly when it comes to hormones and perimenopause. A lot of people don't know this or think about this, but perimenopause can start as early as 35. And
Wow.
so usually, 35, you're still thinking about having babies and things, but you can also be going into perimenopause and you're having these symptoms and you're not thinking it's your hormones, and you go to your GP or your OB/GYN and they're like, "Oh, you're way too early to be thinking about that." But me personally, like my story, I had horrific hormones. I had the worst PMS on the planet. I literally would be bloated for like 2.5, 3 weeks out of every month. People would ask me if I was pregnant. I had
Wow.
mood swings, I had I mean, it was horrible. I was not a happy camper. And when I went into practice and started working with menopausal women, I started to feel like a hypocrite because, like you said, I do practice what I preach. And I'm watching these women who are 20 years older than me because I was in my early 30s at the time, and they're like feeling fantastic and they're hugging me and their husbands are sending me flowers because they all feel so great and they're having these great sex life again. And
Hmm.
I'm like sitting there like wearing this big dress, like I'm so bloated, I'm about to kill someone because I'm about to get my period. And I thought, I need to apply what I'm doing with them to me. Of course, it's different because I'm still a cycling woman,
Hmm.
but I did that. And then my periods got amazing. My PMS went away. So much so that when I went through menopause, I never even had a hot flash because I
Wow.
pre-gamed, right? So I was preparing in my 30s. So it was like smooth sailing for me. So when you have symptoms, it's not to like feel bad about it. It's just to go, oh, that's my body's sacred message to me saying, hey, honey, stuff's out of balance. We need you to take a look. We need you to see what's going on. And in, I practice terrain-based root cause medicine, right? So I don't chase after symptoms. I look at why is this happening? And it's very different with menopause. So someone who's perimenopausal, who's having a cycle, do they always need bioidentical hormones? No.
Mm.
Sometimes it can really be rebalanced through lifestyle, through diet, through herbs, through liver support, et cetera, et cetera. But when a woman is menopausal, the root cause is that her hormones are no longer being produced. And so to me, the root solution, along with all those other pizza pie slices, is to replace the hormones. And I've been doing this a long time. I've been doing this for 23 years now. And I have seen women who come in sometimes like we're our own worst enemy and we sabotage ourselves and we don't even realize it. And I've seen women come in, they're like, no, I want to do it naturally. I'm doing it naturally. Still having hot flashes, still can't lose, my hair's still falling out, all
Mhm.
the things. And I explained to them, and when I explained to them, they're like, oh, okay, I'm going to give these hormones a try. And always, always the same. It's like almost like identical responses. Oh my God, I'm so mad at myself, Dr. Stills. I wasted so many years suffering because I thought taking hormones wasn't natural. And,
Mhm.
I feel so much better now. And it's just time and time and time again. And of course, when I'm talking about hormones, I'm always talking, even if I don't say it, but I'm always talking about bioidentical hormones. You only want to utilize bioidentical hormones.
Yeah, got it. Thank you for that. It's really interesting that, I think women realize this intrinsically that there's such a big drop off in the hormones with estrogen and progesterone in particular that causes relative imbalances with testosterone, which can cause hair thinning. But the imbalance or the drop off is so great that it's very hard to supplement with a herb or try to do lifestyle interventions to make up for the decline in these two hormones specifically. And so that is, I think, the conversation that you have with a lot of women. Also referring to the bioidentical hormone, the Women's Health Initiative that in early 2000s had some negative interpretation of the data, which scared a lot of women off of it, seems to be that that's turning around and women are now more open and are being educated that it's not that harmful. In fact, it's going to help you during this peak time of your life. So if you are consulting with a woman, Dr. Stills, and in the perimenopause, I love that you said that you can handle a lot of this naturally through lifestyle and or herbs. But when it gets to menopause, you got to bring in the big guns sometimes. And so for women that are doing the hormones, what is the perfect age for them to start doing them? And I think you already answered how long to go on for.
Yeah, and I'll answer. I just want to say one, yes, you can't herb your way out of menopause or eat
Yeah,
your way out of menopause because, you know, what the estrogen is doing in the brain, the wild caught salmon is not going to do the same thing. So I'm not
right.
saying don't eat that, it's important to eat healthy. And yeah, it is crazy how the Women's Health Initiative, that poorly produced and how they interpreted poorly interpreted study, how it like took this stronghold and
Hmm.
like became this this folklore now of what is really true, and it's really been debunked. And so it is turning around, but you'll be surprised at how many doctors still go, well, the Women's Health Initiative, and it's like, you need to get educated, you need to pay
Yeah.
attention. So as far as, now I forgot what your question was. What was your question?
Yeah, I was just asking, what is the perfect age for
Oh,
women to
right.
begin these hormones?
So, you know, there's no specific age. The right age is the age when you need them, because everyone's hormones do decline at a different rate, and they do
Hmm.
decline. There are like some skiers where the hormones are kind of just skiing down till they get to the bottom, and then there are some cliff jumpers where it's like you've got hormones one day and boom, the next day you don't. And then there's the roller coaster where it's like
Hmm.
up and down. So there's different ways that I have noticed, and in testing women. So I do think it's really important to get baselines and also to pay attention how you're feeling. So if you have troublesome periods, because a lot of times women have PMS, which is premenstrual syndrome, and they just think it's normal, right? So it's all these common things we've sort of normalized, and it's not normal. It's not normal to suffer. It's not normal to have cramps. It's not normal to have headaches. It's not more normal to bleed excessively. So if you're having any kind of hormonal issues around your cycle, if you have challenge getting pregnant, if you have acne, if you have migraines, if you have been diagnosed with fibroids or PCOS, which is polycystic ovarian syndrome, or endometriosis, some of these really big hormonally, like everyone knows, oh yeah, that's a hormonal issue. So if
Hmm.
this is going on in your younger years, you want to start working on this right away. So like you can be like me in pregame so that when menopause comes, it's not this huge problem.
Hmm.
And so I think it's really important to start checking. And if you don't have any of these symptoms and you're like, haven't had any of these diagnoses, got pregnant easily if you wanted to, periods are great, blah, 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 moods are great, then, around the age of 30, 35, see someone like me and get a baseline. And I was so excited because, so this is my third year doing the Menopause Summit. We're already slated for year number 4.
Nice.
And last year, I really made an effort to say, like, come one, come all, come early. Don't wait till you're up all night having hot flashes. And I was really happy to see that a large number of 30-something-year-olds came. And I do a special offer where I offer a test plus a consult. So you get to have a 24-hour urine test. And we can
Hmm.
talk about how to measure your hormones, because that's another big misconception. And I was so happy to see that. Like I had all these 30-something-year-olds and they're like, I want to get my baselines. I want to see. So just like blood work, I have patients who, usually I work with a woman, then she brings me her husband, then the kids and the cousins. And so I have a lot of kids of patients that I treat. And, we do baseline thermography scans on the girls when they're 15. We
Hmm.
do baseline big blood panels. Like the more you can get baselines, even if you're feeling great, it's so helpful, because then if things start to go astray, we can look back and see what's changing and see what needs to be done. So it's really never too early, but I would say at a minimum like 30. If you haven't been struggling, I'm really not about like turning people into patients if you feel great.
Yeah,
But 30 or 35 is a good time just to get a baseline to see where you're at.
got it. And I do love, in the past few years, I do love working with a naturopathic doctor or an integrative physician because they're going to look at the whole piece of the puzzle, and they're going to go after root causes. They're not going to hand you a pill like they do in, traditional medicine. And it's really changing. The paradigm of health is changing. People are waking up and they're more concerned. They're more in charge of their own health. They know nobody at large, the government's not going to come to save them. Doctors are not coming to save them, and they have to take initiative when it comes to their health. And so it's a really great time to be alive, I think, in a lot of ways, and the public is waking up, which is excellent. So you're saying that women in their teens certainly, but also in their 30s can start to get a baseline. So then you have that data available to you, and then an expert like yourself can look at that data and say, okay, it's a-okay, everything's good, or we need to look at these two things, and maybe we can help improve your gut health or what have you while you're in there. And so then you're primed for having a better perimenopause and a whole menopause experience because you're in the hands of somebody that's an expert in this field. In terms of the hormones themselves, there's two or three that come up over and over again in my conversations. That's estrogen, progesterone, and testosterone. Which ones are the common ones that you talk about or even recommend to your clients?
So estrogen, progesterone, and testosterone are the main sex hormones. So those are always, on the table. But there's
Mhm.
also DHEA, there's also thyroid hormones, there's also adrenal hormones, there's also parathyroid hormones, there's also melatonin, vitamin D, oxytocin. So I'm looking at all the hormones. And it
Mhm.
really depends. I'm looking at what's going on with a woman and what her test results are saying, and then we're marrying the two. So it's always great when someone's test results look great and they feel great. But I'm not just looking, a lot of doctors, especially in mainstream, are just looking at serum and blood levels, and you get misled and you miss a lot of the story. And so estrogen has been very vilified. And, let's just give some love to estrogen because she's a beautiful hormone who has so many powerful effects in your body. And you can't really see what's going on with estrogen unless you're doing 24-hour urine testing. And we
Mhm.
do actual wet urine, not dry urine, which is very popular, but dry urine is not very accurate. And so you can be misled even with that. It's better than serum, but it still is not as good as doing wet urine. And within the wet urine, we can see the metabolites, we can see what estrogen is doing in the body because a lot of these doctors are just slapping estradiol patches on patients, which is like their natural way of doing it. And
Mhm.
they're never checking to see what is that estradiol doing in the body. And is it becoming more inflammatory? Is it metabolizing down the wrong pathways? Or do we have an abundance of 4-hydroxyestrone, which is a known carcinogen and can be a contributing factor to a developing breast cancer? Are they producing 2-methoxyestradiol, which is a lovely metabolite, is actually anti-cancer. So you really want to find someone who didn't just go to a weekend course and now they're a hormone expert because a lot of that going on. So,
Yep.
you want to find someone who really understands hormones and sees the big picture. And you also, so they're monitoring you properly with 24-hour wet urine. They are prescribing compounded hormones that are pure. Because I
Mhm.
just, it's like I've been doing this for 23 years and, I get surprised. I learn something every day and I get surprised every day. And a lot of that comes just through my patient interactions. And we had a patient the other day who said, my OBGYN prescribed me bioidentical estrogen for vaginal dryness, can I take that rather than, buying yours, which I, was not covered by insurance? And I'm like, let me look at it. Absolutely. If it's good, sure you can and save some money. I'm all for that. And when she sent us the ingredients, I like almost fell out of my chair. So two of the ingredients were sodium lauryl sulfate,
Wow.
known carcinogen,
Yep.
and parabens, which
Endocrine disruptors. Yep.
yeah, and
Yeah.
and this is what they're putting in her bioidentical estrogen that they want her inserting into her vaginal canal. So you've really got to be, your own advocate, and you really gotta, I'm like, embrace your inner 2-year-old, and you gotta ask why and what and where and when and how, and you gotta really drill down. And I even learned that from my compounding pharmacies. I started going like this was a long time ago, before I was in my menopausal years. And so like I was prescribing things and thought they were natural because they were bioidentical. It's like early in my career. And then a patient brought in her pills and I was like, why is that orange? Why is that capsule orange? This is not the pharmacy I work with now. And
Mhm.
so I got on the phone with the pharmacy and I'm like, why are you using coloring? Like, this is a natural thing and this is something you're taking every day potentially. So
Mhm.
I'm like so anal, like my pharmacy, they like
Yeah.
we fill our capsules with acidophilus.
Mhm.
So we make it really pure. And like prometrium is a bioidentical uh I guess FDA approved. It's what like, the more progressive OBGYNs, but you have to think about it. Often it's colored, it's orange, and
Mhm.
it's like the filler is peanut oil that, is rancid, right? And
Right.
we know seed oils are not a good thing. And so, if like you were put on it for a week, I don't get crazy. I'm like, it's going to be fine. But if it's something you're doing every day, then you got to really think about like, what are these things being filled with?
Absolutely. 100%. I think just the conversation you had, these two conversations, what is it? What is it? What's in it that you're taking every single day, but also all the metabolites that nobody will ever check for unless they're really well versed in this topic, which I guess anybody listening, that should be a wake-up call that there's a lot going on under the surface. I have personally been to a clinic at age of 37 where they tested my testosterone and said, and I was under a lot of stress at that time. They said, "Oh, you're a candidate," because it was like 500 or 550. They're like, "You're a candidate." And they didn't ask me any other questions. They're like, "I'm ready to give it to you. Not about my lifestyle, not about my health, my workout, nothing." They're like, "Here you go, pay me every month." And my male friends at that age were getting it. And I refused. And 2 years later, my testosterone was 850. And so naturally, and so it really goes to show that you can't just trust anybody that's not even asking you the basic questions that are required for a practitioner that you're going to put so much trust in. Um, so with that said, thank you, Dr. Stills. We're coming up on time, but I want to ask you one other question. There is this stigma of a lot of estrogen over a long period of time being related to or causing breast cancer. So what are some thoughts around that, and how can women be assured that it's not going to cause breast cancer, or what are some ways to mitigate that?
We're just sending an email out about that tomorrow because that does come out a lot, and
Yeah.
it's just not true. Estrogen does not cause cancer, but can unopposed estrogen, remember, estrogen is just a word. There's types of estrogens.
Hmm.
So can too much estrone or estradiol, which are hitting the proliferative receptors, the alpha receptors, with no estriol on board that hits the beta ones, which are anti-inflammatory, can too much estrogen and xenoestrogen, so these toxic estrogens, these parabens and so forth, can they put you out of balance? Sure, if you don't have enough testosterone, if you don't have enough DHEA, if you don't have enough progesterone, if your liver's clogged and so on and so forth. But when we are pregnant or when we go through puberty, when teenage boys have raging testosterone, we don't see prostate cancer. We don't see breast cancer. We're seeing this predominantly post-menopausal, post-andropause, which is the male version of menopause, where men stop producing testosterone. And so it's like that women's health initiative. It is just taken hold and it's not true. I can tell you because I work a lot in oncology, in naturopathic oncology. It's one of my specialties.
Hmm.
And so I've worked, I can't tell you how many women over the year with a breast cancer diagnosis. And I'm always using bioidentical hormones to help them to get rid of the cancer, to make the cancer go away, to prevent the cancer from coming back. And if a woman has a higher risk of cancer, I'm using them to prevent her from getting a diagnosis. So it's very mishmashed out there. That's the whole hormone thing. It's like, and there's so much noise and it gets scary, right? It's
Hmm.
like,
Hmm.
same with chemo. You got to take chemo if you've got a cancer diagnosis. That's not true either. Most of my patients who chose not to do chemo are the ones who do really fantastic. So that's a whole nother
That is a whole different podcast.
that's a whole nother basket. But
Yeah.
yeah, so if you are working with someone who just, yeah, doesn't ask you the right questions, doesn't monitor you the right way, just throws hormones at you, yeah, they can be contributing to a cancer diagnosis, and cancer too, go back to my pie, cancer diagnosis is always multifactorial.
Hmm.
Most disease is very energetically based. There's an emotional component to it, except menopause, right? Because
Right.
menopause is just a natural transition. It's not a disease. It's like death, taxes, and menopause and andropause for the men. It's happening. There's
Hmm.
no stopping it. And I know there's like people out there now who are trying to stop menopause. That's a little cuckoo to me too. And so when I'm replacing hormones, because there's another confusion out there, I'm not trying to make you 20 again. You don't need to have a period. We don't need to give you such high doses that you're building up a uterine lining that needs to be sloughed. That is
Hmm.
incorrect. We're giving you enough to get rid of your symptoms, to help you feel fabulous, and to prevent chronic illness. And you do not, I repeat, do not, I've been doing this 23 years. I have the patient population to prove it. I've watched women over the last 23 years because I have a lot of patients who've been with me that long.
Hmm.
They are, knock wood, but they are not getting diagnosed with cardiovascular disease, with cancer, with dementia. They are traveling the world, they're riding motorcycles, they're sailing boats, they're starting new careers, they're enjoying their grandkids, they're just like rocking it. And so I'm so mad, back when I started, like there was really no internet. Like I should have taken pictures like before and afters of them then because it's quite remarkable.
Hmm.
But so yeah, so there's a lot of fallacies out there, and it's really, I hope that this gives you, like, if you just go through this interview and write down, you can kind of make like some of the points I brought up, you can kind of make a checklist
Yeah.
that you can use to then interview a hormone doctor to see like, are they on the right path or not?
Agreed, agreed. It's very important these days to pick the right provider that you feel good with and that's actually knowledgeable in what they're doing. So, Mastering the Menopause Transition Summit 3.0 is coming up October 1 to 7 of this year, 2024. Dr. Stills, tell us what you have in store. Who are you bringing on? Why are you so excited about this summit? And why should people really log in and listen to what people have to say on there?
Well, you want to see your favorite host here, Faraz. He's got an interview. You'll see him on day one. It's 7 days. I have worked my buttocks off. I've done it's 50 or 51 interviews. They're all brand new interviews
Wow.
with some of the top names in the field, many names that you will know. Every morning I kick off with a 15-minute, here's the Dr. Still's wisdom of the day. I pick some important topics. And we're really just changing the conversation. We're getting you educated. The summit is free. Faraz has a link for you to sign up. Once you sign up, it's free for 7 days. So every day there's about 7 or 8 talks, and you can watch as many as you want. You can watch them all if you have a lot of free time. If you don't, when you sign up, there's also a really, I think it's like $99, and it gives you like access to all the summits, and it's really reasonable. And then it can be in your library because, for instance, like Faraz and I have a great talk about menopause and hair loss. And maybe right now, today, that's not an issue for you, but maybe in 5 years it will be. And so then it's in your library, and you could be like, oh, I'm going to go back to my library and I'm going to watch that talk that Dr. Stills and Faraz had so I can see what I can do now. And so we talk about everything from hormones to detox, to exercise, to gut health, to emotional health, to energetics, because as hopefully you know by now, I'm not a very straight, pigeonhole doctor. I'm looking at everything body, mind, spirit, and that is reflected in the guests I have invited to be a part of the summit. So it really, it's like having a baby. I mean, I've been working for 9 months to get this launched and to bring it to you. And it takes a lot of work, a big team. And the reason why I do it, because like you said, I am opening up a 7,000 square foot clinic and I am running my private practice. And so I'm pretty busy. But I do it because the responses I get every year, it just like, it makes me feel like I'm making a difference. And that's, one of my missions is to really make an impact and make a difference in women's health. And women are just so grateful that all this knowledge is in one place. where they can really get the truth and get rid of the confusion and get on their journey and feel great so then they can go do what it is they want to do with their lives, whether it be just have better relationships, be more present for their families, start a new project, travel the world, whatever it is. And so that's a little bit about what you have in store for you if you sign up.
Yeah, it's wonderful. I was just checking all the guests that you have that are speaking on your summit, along with yourself, Dr. Stills, and it's the who's who. Like there's a lot of experts that, as Dr. Stills said, can really help solve a lot of the challenges that women go through in perimenopause and menopause. And so Dr. Talks is hosting the summit, and I'm just so proud to be associated with you and partnering with you in a small way, Dr. Stills, and also help get the word out because this is information that needs to get out there. Women have been struggling needlessly for too long, and they're finally taking their health in their own hands. So I'm very excited for this. Any other links that you want to share about how people can find you on Instagram or other sources?
Dr. Sharon Stills on Instagram, drstills.com is my website. But if you can, if you click on Faraz's link, and I'm so grateful for your support and your sponsorship. Thank you so much. You'll see lots of me at the summit and find lots of ways to connect. We always have lots of after parties as well after the summit. So you want to sign up, and like I said, no pressure, come as little, as much as you can. There are so many nuggets in the summit, and even just one nugget, one
Mhm.
thing can change your life. So
Agreed.
trust that you'll hear what you need to hear.
Perfect. Dr. Stills, thank you so much for coming on and look forward to watching the summit myself, but also encouraging others to watch it.
Thank you. Thank you, everyone.